the heart. The heart lies in the central chest with majority of mass to the left of midline. Heart is most commonly assessed by median sternotomy to thoracotomy and may also be used in specific circumstances as minimally invasive cardiac surgery. And directly behind the sternum lies the right ventricle, and it's important to note that repeated sternotomies, right ventricle may be adherent to the posterior surface of the sternum. Both vagus and phrenic nerve are close relation to the heart and are at the risk of injury due to cardiac surgery. So the pericardium is the outer membrane of the heart. It is composed by a fibrous external sac and lined by a smooth and serous pericardium. The outer fibrous sac is attached to central tendon of the diaphragm via pericardiophrenic ligament and the sternum via the superior and inferior sternopericardial ligament. The heart during development forms a loop and invaginates into the serous pericardium, causing it to reflect it on itself, and this reflection leads to formation of two distinct serous pericardial layers, an outer pericardium and the inner visceral pericardium. The space between the two pericardial cavities filled with a thin film of serous fluid which acts as a lubricant. The parietal pericardium lines the outer fibrous sac while the visceral pericardium adventitia of the great vessels. The inner layer extends onto the aorta several folds known as Ventricles folds and form a 1 to 3 centimeters along 2 to millimeter wide band of fat approximately 2 to 3 centimeters above the aortic origin. The heart sits at top of diaphragm and resembles a pyramid. The anterior or sternocostal surface combines with the inferior diaphragmatic surface to form an acute margin of the heart. On the left of the costal surface of the left lateral surface is obtuse margin. The ventricle is mostly hidden by view of the right ventricle but extends inferiorly and laterally to form the apex. Superior to the right ventricle is the right atrial appendage, and tracing the posteriorly leads to remainder of the right atrium along the superior and inferior vena cava. With the heart retracted, the left atrium and the right pulmonary veins can be seen with the fibrous skeleton of the ventricle myocardial fibers are organized as a simple band moving two loops, basal and apical, extending into AP and aorta. The muscle fibers themselves travel in the way that they form reciprocal spiral, resulting in the helical heart structure. The helical nature of muscles fiber result in concentric constrictions of the left ventricle, while the right ventricle wrings itself out, using the muscular interventricular septum to beat against. They are attached to the central fibrous skeleton, which provides electrical insulation between the ventricles and the atria. The valves of the heart are supported by the fibrous skeleton and are juxtaposed to the aortic valve is wedged between the mitral and tricuspid valve. Heart has got 4 chambers. Atria divided by intra-atrial septum. The right atrium consists of an appendage, a vestibule, and the venous component. The venous component sinus venerum is an untrabeculated portion derived from the sinus venosus and receive blood from SVC and IVC. This is separated from the wide-based trabeculated appendage primitive atrium by crista terminalis internally and corresponds sulcus terminalis externally. The sulcus terminalis represents the right sinoatrial valve, and it is the lower portion of the Thebesian eustachian valve, guarding the coronary sinus and IVC orifice, respectively. Its extension towards the anterior septal commissure of the tricuspid valve is called as tendon of Todaro. The tendon of Todaro in the coronary sinus opening and the septal portion of the tricuspid valve forms the triangle of Cox. The left atria is the only midline chamber of the heart similar to that of the right atrium. It also consists of an appendage, vestibule, and venous component. The left atrial appendage is a long and has a narrow base, finger-like, and its junction with the vestibule, the atrial wall between the left pulmonary veins and the appendage, is sometimes confused with thrombus on the echocardiogram and is referred to as Comedian ridge. The surgical access to the left atrium is most commonly obtained through the interatrial groove. Other approaches, including incision through the dome of the left atrium and incision through the right atrium. The sinus node artery is commonly taken in these surgical procedures, and the resultant sinus node dysfunction contribute to the need of a permanent pacemaker. Approximately 20% of the patients who have mitral valve is approached via the superior septal. The right ventricle is coarsely trabeculated and crescentic shaped, thin-walled, tube-like structure, and it is composed largely of inlet portion, the sinus and the trabecular portion, and the small outer portion. From here, the blood flows into the thin-walled apical portion, and this section is lined with the rough muscular ridges. The left ventricle, LV, and the aortic valve, like the RV, LV, consist of the inlet trabeculated apical and outlet portion, and each of these components, however, differs from RV counterpart. The right ventricle. The blood supply consists of right coronary artery and left main coronary artery. This left ventricle. The conduction system consists of SA node composed of a specialized myocardium located in the right epicardium lateral to the cavo-atrial junction, and there are three preferential internodal pathways, which is situated at the center of the triangle of Cox. The bundle of this travels towards the anteroseptal commissure and tricuspid valve and perforate the right trigone of the central fibrous body. The systemic circulation explained, and these are the heart valves, mitral valve, tricuspid and AV valve. These are chordae tendineae. These are pulmonary semilunar valves. These are aortic semilunar valves. Thank you.